Hey guys, I'm Lauren. I graduated in May 2016 from Edgewood College in Madison. I majored in biology, minored in chemistry and psychology, and now I'm just gearing up to start PA school in January. Just a little bit about myself and my background. I'm originally from Pittsburgh, PA, so prior to going to Edgewood, I did attend a small community college in Pittsburgh where I obtained a diploma in drug and alcohol abuse. I applied to 6 different programs. I had a pretty specific location that I was looking for. I mainly wanted to stick into the Midwest, so Madison, Milwaukee area in Wisconsin. I applied to a few in Chicago and 2 in Pittsburgh since that's where I'm originally from. Someone asked what my stats were, so I'm just going to put those in the little text box below. For my patient care hours, I got most of them over the past 4 years. I've worked as a physical therapy specialist. But prior to that, I did have a nurse's aide job when I lived in Pittsburgh right out of high school for about a year and a half. So for those who don't know what a physical therapy specialist is, it's not a very common job. I work directly with a patient with a traumatic brain injury. Someone asked how I decided I wanted to be a PA, and the truth is it was a long and non-traditional route. Coming out of high school, I wanted to go into healthcare. I had a lot of family members and friends that were either going into nursing school or were nurses, so that kind of sparked my interest. But the more I learned about it, the more I knew it really wasn't exactly what I wanted to do. So, like a lot of people who want to go into healthcare but aren't really sure what field, I started my college experience just going the pre-med route and seeing where it would take me. I decided to shadow a lot of DOs, MDs. I had a lot of nursing friends, like I said, so I kind of saw how, their everyday jobs went. And back then, I didn't even know what a PA was. It wasn't until a close friend of mine asked me if I had ever thought about the physician assistant profession, and I looked more into it. I did more research. I started shadowing, and the more I learned about it, the more I decided this is exactly what I wanted to do. That's my advice for anyone who's not really sure what field they want to go to in healthcare. Get out there, start making connections, learn about the different professions, shadow if you get the opportunity. That way, when you end up making the decision on what you actually want to do or pursue, you feel a lot comfortable and confident in your decision. I had 2 different PA interviews. One was more of an MMI style, and the second one was broken down into 1 group interview and 2 one-on-one interviews. I actually got offered a 3rd interview, but decided to decline it. I fell in love with one of the schools that I went and interviewed at. I absolutely love the location, I love the faculty and the whole entire program. So once I got that acceptance letter, I decided then and there that I wasn't gonna even go to any more interviews or check out any other programs. First thing that I suggest is to familiarize yourself with the type of interview that the school will be giving you. It could be MMI or multiple mini interviews or one-on-one, 2-on-2 group interviews. So the first thing I think to feel confident is just familiarize yourself with whatever interview that you're going to have to tackle that day. Of course, make sure that you're familiar with everything you talked about in your application. They're going to ask you a lot of questions about your experiences and how that's prepared you for PA school. Specific interview questions, I read a book, it's called Why Medicine, right here. I found that very helpful for just preparing myself for any type of questions they might ask. But you can also find a lot of interview questions online. If you have the opportunity to do a mock interview, those are always very helpful, get you that state of mind. As a physical therapy specialist, I work in a home-based setting. So I go to patients' homes and I work. Hi, Oakley. All right, let's try that again. As a physical therapy specialist, I work in home settings. I don't work in a clinical setting. I work solely on my own. I don't work under any physical therapist. I got all on-job training, and I just work with these patients to do rehabilitation and developmental therapy throughout their everyday normal lives. I also just started an Instagram page with my best friend. She is also on her journey to becoming a PA as well. She's graduating in December and is about to take a gap year. I'm going to go visit her, so if any of you have any questions for her, feel free to send those now.
Hey guys, I'm Noemi. I'm Lauren's friend, and as she mentioned before, I'm still finishing up my undergrad at Edgewood College, and I majored in chemistry, biochemical concentration with minors in biology and psychology. As far as why I'm personally taking a gap year, it is because I am a mom. So I had my daughter when I was 17 years old, and I've always known that I wanted to be a PA. So I want to use this year to really just focus on my extracurriculars and making myself a more well-rounded student so that I can be more competitive when I do it.
Biology major at Edgewood, it was a requirement to do at least one semester of research, but I actually ended up really liking research, so I did an extra semester and I focused mine on breast cancer research.
I have done 2 separate research projects. One was looking at the catalytic activity of the enzyme cellulose, and then this semester I'm working on analyzing some sediment from a lake that is near my college and looking for some hydrocarbons, and then really focusing on learning to use the GCMS at our college.
So I've been a little MIA, and that's because I had to actually drive to Chicago from Madison, Wisconsin to do a home inspection on the place I'm going to be living once I start school in January. But one of the questions that I got, and I answered people directly, but I actually got it a couple more times, so I figured I'd just put it on the story. And it was whether they thought my community college experience actually affected me negatively, where maybe a PA program actually rejected me. And honestly, I can't answer directly because no one really gives you a reason why you're rejected. But I did have, 2 interviews. I got another interview offer. I was also waitlisted for another interview, and I'm still waiting to hear back from a couple of the PA programs that start in later, like August. So it's definitely a possibility. I can't answer for sure, but it obviously hasn't stopped me to a point where I've been accepted into a school, because I have been accepted. I am going to PA school. So if you started out at a community college to save money, or you thought that was the best route at the time, I don't think it's going to negatively impact you where you're not going to be able to get. The most difficult class that I had was biochemistry. Even though I had that chemistry background, I'm not necessarily the best at chemistry, so it was definitely a struggle, but what got me through it was a lot of time management and the fact that I actually did like the content of everything that I was learning. It's just a hard class, it's upper level, it's very detailed, and it just took a while to get the hang of how to study for those type of tests. I did volunteer before applying to PA programs. I did numerous little volunteering at school for different programs, different activities and things like that. But I also did volunteer for a long period of time at the American Red Cross. I think it's been about almost 5 years I've volunteered there. So that's my suggestion of anyone that's looking for volunteer hours. Always check around at the American Red Cross. From my experience, they're always looking for more volunteers to help out. And for anyone specifically in the Madison, Wisconsin area, I did volunteer for the fashion show for All Abilities over the past 4 years. It's a fun event that allows you to get some hours and experience, but you also get to have a fun time with all the models and everything. So if you're in the Madison, Wisconsin area, make sure you look out the fashion show for All Abilities. I know they're having some trouble with funding this year, but I'm hoping, I know everyone's hoping that it comes back, so check that out if you're in the area. I did shadow a few PAs prior to applying. Most of those were family practice PAs, but I did get the opportunity to shadow a cardiothoracic and vascular surgery PA, and that was the most fun I had shadowing. I got to sit on some of the surgeries and see how pre and post-ops went, and that kind of gave me an idea and a spark of interest for the surgical specialty. I can't say for sure that that's what I'm going to do, of course, until I actually go to school and see how I like doing it myself, but it definitely sparked my interest. I don't think I can necessarily say that I recommend it, but I don't think it's something to defer from either. It allowed me 2 years of being debt-free. I did take some of my science prereqs there. I took AP 1 and 2 and microbiology at a community college, and I don't think it hindered me in any way going into college or university, and I don't think it's going to hinder me going into PA school either. Alright guys, I'm going to stop my Snapchat takeover here. I'm about to embark on my journey back to Madison, Wisconsin. So if you have any other questions or concerns or anything, feel free to message me on Instagram. I'll put the little whatever thing down here again, so where you can find me. And my friend Noemi, so if you have any questions for her too, feel free to message that Instagram as well.